American culture is saturated with drugs, both legal and illegal. Commercials regularly tout various drugs to offer relaxation,
escape from tension, and improve sexual function. Millions of parents, often with the encouragement of schools, try to control their children's behavior with Ritalin, and if that doesn't work, they ease their own irritation and anxiety with Xanax or maybe a glass of wine, and help themselves to sleep with Ambien or Lunesta, or perhaps Viagra or Cialis. And the kids who have gone off to college use Adderall or 5-Hour Energy or Starbucks with a double shot of espresso or several small glasses of strong Turkish tea, which can keep one awake for an extended period. Research indicates that the omnipresence of drugs in our culture is more important than peer pressure. And that's not likely to change. We might wish they didn't use drugs, but many teenagers will experiment with cigarettes, alcohol, marijuana, and other drugs before they graduate from high school. By the way, I have a strong personal interest in this. I have 9 grandchildren whom I follow on Facebook, but I don't comment much lest they unfriend me. But I don't want them to get involved or to get into trouble with drugs. Now, by drugs, we usually mean marijuana, cocaine, methamphetamines, psychedelic drugs such as LSD, ecstasy, peyote, mushrooms, inhalants, glue, paint, heroin. It's important also, though, to include nicotine, alcohol, and prescription drugs. All of these can alter the way a person feels, thinks, perceives things. Most of them can be habit-forming. Some of them can be seriously addictive. Half of Americans use alcohol regularly. More than 97 million over the age of 12 had tried marijuana at some point. That fact is not lost on their children. Nearly half of American high school seniors, 47.4%, have experimented with illegal drugs by the time they graduate. 72% have experimented with alcohol, which is illegal for them. Kids see that America is hardly drug-free. They know the difference between experimentation, abuse, and addiction. Many of them have seen their parents use alcohol without abusing it.
A glass of wine at dinner is different from a glass of wine at breakfast, and they recognize that. They understand that using alcohol does not automatically lead to the use of others. Despite the undeniable fact that some kids ruin their lives with drugs, most experimenters do not become abusers. It's important to remember that. Many know that their parents have experimented with marijuana at some time in their lives without abusing or continuing to use. If you noticed one of Dr. Alexander's slides there showed the rate of use of people who were in their 40s and 50s and 60s, people who used marijuana in their 60s, and it's pretty low. It is not a continuing thing for most. Most youthful drug use is experimental, and fortunately, the vast majority of young people get through adolescence without much trouble. Experimentation can get out of hand. It can lead to abusive patterns, and put themselves at risk, despite the fact that most don't get into trouble with it. Now, in talking about the drugs, I can talk about cocaine, heroin, meth, LSD, but actually small numbers of kids use those, and I thought we would have a larger scattering of children, audience of children here today, and I expected that most of them were not going to be involved in those. But I want to talk about 3 of the main drugs: alcohol, tobacco, and marijuana. Now, in Islam, you know that Islam or alcohol is haram, forbidden. Many Christians feel the same way. Many other Christians do not. Mormons also prohibit or preach against caffeine. Turkish Muslims are severely addicted to it. But tobacco. Tobacco is the world's #1 killer, causing nearly 4.9 million deaths annually, 440,000 of those in the United States. That is the equivalent more than 2 jumbo jets crashing every day, killing everyone on board. That's a pretty serious drug. It is certainly highly addictive. It is one of the hardest of all drugs to kick, and it's one of the most dangerous. You know the health issues related to it. It also leads to wrinkles, to yellow teeth, and it makes your breath and your clothes smell really bad. It is also, can probably be said to be the true gateway drug. Nearly all people who get into trouble with drugs started with cigarettes and alcohol, usually quite early. Nearly 90% of smokers get started before they are 21. Smoking correlates with social class and lower self-image in this country. There's some exceptions to that, but it's generally a pretty good correlation. Education against tobacco use has been really pretty successful. Really dramatically lowered the rate of smoking in this country. Now, alcohol. Alcohol is widely used. It has some benefits. It can be an enhancement to food. It's enjoyable by itself. It can be. Many doctors recommend a glass or two with red wine to help prevent cancer, heart disease, and some widen that to include any form of alcohol used in moderation. At the same time, it is the second most deadly
and overall our most dangerous drug. According to the CDC, the excessive use of alcohol takes the life of 79,000 people in this country every year. The Office of National Drug Control Policy raises that to 100,000. 1.9 million people each year die of overuse of alcohol. The costs of alcohol abuse in this country run in excess of $200 billion per year, and in Texas, underage drinking costs something like $5 billion a year. Nearly 2,400 teens are killed in alcohol-related accidents every year, and a far larger number than that are seriously injured. In Harris County, 4 of the 5 hot spots where the most DWI crashes occurred in recent years are right along the Southwest Freeway, 59, which most of us drove to get to here today. Alcohol figures in a high percentage of homicides, assaults, fights, rapes, spousal abuse, and the mistreatment of children. Now, the line from alcohol to assault is not straight, but is bent by such factors as age, education, social class, culture, setting, individual personality. But the association is strong, and we have all seen its effects. Alexander talked about
pot being seen as more peaceful. We do not hear of pot room brawls. That's not the way it turns out. Now, 70% of kids have tried alcohol by the time they finish high school. 55% report having been drunk. 66% have drunk flavored alcoholic beverages, which are produced to attract young people to the use of alcohol. If young people use alcohol, despite the laws against it, and are urging them not to, it's important to stress, and if we use alcohol,
to serve as a model that there is a huge difference between use and abuse. Even if they don't drink themselves, they should know how to recognize irresponsible behavior when it comes to place, time, and dose levels and frequency of use. It is impossible to do well in school when you're intoxicated, and it's extremely dangerous to oneself and to others to drive while intoxicated. Kids should be taught never to get in a car when someone is driving who is even close to intoxication. Should call a parent, call a cab, and also to be extremely careful on the roads after 10 o'clock in the evening. And the later it gets, the more likely the higher percentage of people who are driving are going to be under the influence of alcohol. Now, let's get to marijuana, to cannabis, and I'll try not to duplicate too much of what's already been said. And if you look at the slides, there was so much more you could have talked about, I am aware. 42% of kids have used cannabis at least once by the 12th grade, according to the Monitoring the Future survey. The good news is that 90% of kids between the ages of 12 to 17 refrain from regular use. The good news in Harris County is that average past month use is only about 4.5%. For all other, and this is also good news, for all other illicit drugs, it is less than 2%. And for most of them, it's less than 1%, with the exception of non-medical use of prescription pain relievers. If you also notice that pie chart, pain relievers or prescription drugs are a very large part of the problem and an increasing one. There are well-documented medical benefits, as was mentioned. It can relieve chronic pain or nausea caused by chemotherapy or for cancer. It can reduce ocular pressure in glaucoma, fight weight loss caused by AIDS, and reduce the muscle spasms of multiple sclerosis. My wife went through breast cancer chemotherapy over the last year and a half, and a surprising number of surprising people offered her, said, I can get you some marijuana if you need, and take it from me, it works. People that we never would have thought would know anything about it, but they'd said, I tried everything, and finally I tried that, and it does work. Recreational use produces mood alteration, distortion of perception, relaxation, peacefulness, euphoria, and it also can make people feel silly, panicky, or paranoid. Heavy use can lead to loss of concentration and deterioration of short-term memory, at least on the short range, poor educational performance, decreased drive and ambition, impaired motor skills, increased anxiety, difficulty in limiting use and dependence. When I was teaching, I actually retired from teaching several years ago, but when I was teaching, students would come and say, I'm not too excited. My classes are kind of bogus, and I think next year I'm going to just take off a semester, and I got a friend who can get me a job driving a beer truck. And I said, how much dope are you smoking? Why do you ask me that? Well, because whenever I ask that question, I've never run into anybody yet giving me the syndrome that wasn't smoking a good bit of dope. It can interfere with one's schoolwork. The risks. Accidents, as mentioned. Using marijuana can lead to increases the risk of auto accidents from 1.3 to 3.1 times. This is over a series of studies. The figure for alcohol is 6 to 15 times. So it is much worse. If caught, a kid can be at the mercy of a punitive juvenile and criminal justice system, and often at a punitive educational system. If arrested, which is not likely but can happen, does happen, nearly 850,000 people were arrested last year for marijuana, and about 90% of those for possession alone. That far exceeds the total number of arrests for all violent crimes combined: murder, negligent homicide, forcible rape, robbery, aggravated assault. This is a tremendous waste of criminal justice resources and that should be dedicated to combating serious crime. It has a huge impact on lives. Federal penalties can be, often are not, but can be up to a year in jail and a $1,000 fine. In Texas, it can be up to 180 days in jail and a $2,000 fine. It's usually probation, but that's not like a traffic ticket. If you happen to have 2 bags, one for a friend or maybe just 2 bags for yourself, you can be charged with intention to distribute, and the possible penalties there go way up. You can, if you could lose your car, you could lose your house. You could have a beach house and have kids with a party. Cops come in for noise, find dope, and if they decide they want the beach house, they can take it. You can be expelled from school, barred from sports or other activities, sent to a special school, lose your driver's license, lose your friends, lose your chances of getting going to a good college or getting a scholarship. 200,000 U.S. students have been denied college loans because they've had a drug offense. Parents can be denied or forced to leave public housing, and if they finish college successfully, a young person can still have difficulty obtaining, let's say, a professional license, a law license, or a medical license. That, of course, applies to other drugs as well. And perhaps Dr. Valdez will talk about this, you're supporting violent criminals. Ciudad Juarez is the most dangerous city in the world on our border. 2,600 people killed last year in drug wars. Week before last, I think it was 67, just for the weekend. It is a terrible. Much of this is due. These are unreasonable penalties, and they are unfairly enforced. And I contend that marijuana should be legal. I mean, legalized. By that, I don't mean put in little gumball machines that you give out at McDonald's. I mean, it should be regulated and taxed as we do other serious substances. I've argued that at greater length in the October issue of Texas Monthly. You can find that at texasmonthly.com. and you may have to register something, but you can get it free. Contrary to the common belief, it has not proved to be a gateway drug.